Let's talk about healthcare. It's not a line item on our budget today. But if we allow it to creep into our budget, it will become a major line item. Did we need to go through the gymnastics that we went through on healthcare this summer and this fall? No. Did we need to help the people who do not have medical insurance? Yes. If we look at it from four components, four simple components. You have the suppliers, you have the users, you have the insurance companies, and you have the lawyers. Let's look at each of those briefly. The suppliers. The doctors on our team say we need to increase the supply of doctors. Simple supply and demand curve. Increase the supply, the demand goes down. Demand goes down, the cost goes down. We need to get the government out of regulating and over-regulating doctors and medical facilities so we can increase the supply. Let's look at the next item, the user. You and I. When insurance was first put in play for healthcare, it was supposed to be catastrophic. Now we have maintenance programs. What I mean by catastrophic, it was supposed to have large deductibles. I have a heart attack, the bill's $10,000, I pay my deductible of $1,000, it doesn't bankrupt me, all's good. But now, we only want to pay $20. Did you see the John Stossel report? If they had grocery insurance? Just think about that, grocery insurance. You're walking through the aisle, and you're pushing your cart, and you come up to the hamburger steak aisle, and you go, hey, I'm taking steak. It's the same price, it doesn't cost me any more, I'm taking the steak. And as John reported, he walked up to the wine aisle. There was a $7 bottle of wine and a $77 bottle of wine. He took the $77. It didn't cost him any more. How many of you ask your doctor how much it's going to cost for the medical treatment you're going to get that day? But every other item in our lives, we check the pricing. We check the difference between one bread and another. We're buying tires for our car, we can call 4 or 5 places. But when we go to the doctor, we go to one doctor, we don't ask him any questions. We plop down our insurance card, it's got a $20 deductible, and that's all we pay. But is it all you pay? You're paying much, much more through the premiums. Third, let's look at the insurance companies. We need to deregulate the insurance companies. Let them cross state lines. There are kids coming out of college every day who would love to have a crack at 1/6 of our economy. But oh, we're overregulated. They can't get in. But if they could, they would do it smarter, faster, and cheaper. And that's what made our society great. We always figured out how to do things smarter, faster, and cheaper.